Thank you so very much for joining me today. As you know, I'm Amy Mansu, CEO of Inspira Health, and today I have the honor of being with Anthony DeFabio, the president of Ascenda Health. Dr. DeFabio has been one of the warm receptions that I've received since coming to South Jersey, and we've had great conversations about the work that Inspira and Ascenda can do, and I just really am grateful for being here, but really look forward to talking about your story and Ascenda's story.
It is a pleasure to be here. I'm looking forward again to spend some time with you.
Yeah, and we are so grateful, obviously, for the tremendous work that you and your team have done, especially during COVID. Yeah. It was not easy for any of us in healthcare, but especially for those in the behavioral health space. So tell us a little about your journey. Did you grow up in the area or?
So I actually grew up in North Jersey. So the tale of two New Jersey. So I was north of 195. So part of the New York, New Jersey side as opposed to what is now my new home of the Philadelphia, New Jersey side. And grew up just outside of Newark. And actually my journey really was tailor-made for me to be in the role I am today. And it involved me through my family experiences having the impact that a lot of the families who are using our service today had. And so our family was an amazing family, came over from Italy. My dad migrated over through Ellis Island. Oh, wow. My mom's family was also Italian. She grew up in Newark. Very poor family, but no shortage of love in the family. But what was interesting was we were confronted with a lot of different challenges. You know, my parents were very young and working really hard, but one of my sisters, who's an amazing, amazing mom now, but she had some pretty significant medical challenges where she really had to go through numerous medical procedures, surgeries. She spent literally months of time in the hospital, and a lot of our play dates growing up were at the hospital, and a lot of our time as children were staying at different family members' houses because my dad was always working. Right. Another one of my sisters has neurodiversity. And so we learned about seizures, and we learned about, you know, what it means and represents for someone where they're not maybe hitting some of those milestones and where they might progress through life, a life of incredible value and incredible purpose and incredible impact. But maybe by other people's lenses or standards, maybe they might act or be a little bit different. The oldest was probably, and I don't know if she'll ever know, but she was my greatest inspiration because she was the oldest with all of this going on. Right. And I think, you know, she was introduced to some of the wrong people. And as a result, she went down some paths with substances, you know, that really put her deeper into other complex challenges. And I think, you know, a lot of us have seen this story. It's
so interesting when you talk about the family dynamic, right? I mean, and also how you then end up dedicating your life to people who are, you know, you are now supporting through their own journey.
That's exactly, you know, what's interesting is like, it really speaks to not only my development and evolution as a leader, but ultimately, in a very humbling way, the evolution of Ascenda, where we realized that the organization before Ascenda, you know, was called Robin's Nest, and they started as a group home for adolescent girls who were labeled incorrigible, you know, in many instances because they were trying to protect themselves or run away from pretty challenging situations at home, but the system was
abuse, neglect, things that, you know, sometimes people find themselves in.
That's exactly right. And in the case of Robin's Nest, they were given a loving home to be able to come to and get support. Off of that program, Robin's Nest built in-home services. We were realizing there was some great stuff happening within that residential home, but then they were going back into that household, and maybe that household, the parents, the caregivers were not given the tools to be able to really accept them back in a way that was going to be healthy. For most of those individuals that were, you know, working through Robin's Nest, the children that were in our services, the families that we were working with, at the root cause of that was, you know, no surprise, poverty, homelessness and housing instability, mental health challenges that the parents themselves are going through, substance use challenges, domestic violence. And so the vision that is Ascenda was and is for us to be an organization in a more holistic way, in a more integrated way, is able to say we're going to be there with and for that child, with and for that adult with serious persistent mental illness, with and for that family that is trying to navigate some of the challenges that life can sometimes put in their way. And we're going to do that in a way that is going to be non-stigmatizing, non-judgment, but is, you know, rather going to be focused on empowerment and compassionate care that happens to be evidence-based and really best-in-class care. But for them, we want them to feel valued. But in point of fact, we have over 50 different locations. Wow. We provide services to individuals from every county, but we have locations in 12 of those counties.
That's amazing. How many employees do you have now?
We are about 750 or so
Wow.
employees. This year we'll provide support and services to over 20,000.
20,000 people. Wow.
Yeah.
Again, children and adults.
Children and adults. Core community mental health programs, everything from outpatient to partial outpatient, intensive outpatient, psychiatric screening and crisis programs, residential treatment programs, and then we were able to build out an exciting network where we were able to get further into prevention services, and we were able to build out our maternal health programs. And at this point, we have over 100 different programs and services. Yeah.
So how do people access these services? Do they go through their counties? Tell me.
What we've tried to do is structure it in a way where we can have an access center model. So if someone calls 844 for Ascenda, they are able to speak to our staff and ask questions and let them know what it is that they're looking to get support with, and we can walk them through that. We also have a website, our ascendahealth.org, that has a lot of information for them. The truth, though, is that in some instances, some of our programs are gatekeeped.
Right.
And I don't mean that to be derogatory. It's just
reality.
If you're not going to have access to, programs in support of children that are involved in a child protection and permanency program,
Unless they're in crisis.
Unless they're in that situation.
Right.
And so there's a lot of questions. And I think one of the things, and I know your team has been working on this, we're working on it together at an unprecedented level, is when they're experiencing that level of need, when they have the complex challenges that are confronting them, they're scared and they're worried, they're fearful, they feel like they've lost control. We can't ask them to figure out how to navigate a system that might have 20 different providers across a certain area that has different criteria for those. We wanted to say, make this call.
Yep.
Call our access center. Call your access center, and we'll walk them through how they can get the supports and resources they need.
One of the things I just love about Ascenda, and mostly about your philosophy, is how do we break down those barriers, right? Unfortunately, there's more than enough need.
That's right.
We don't need to compete for this. We need to figure out how to do this better, and by trying to create that seamlessness, I think we are trying to work on that together.
Yeah.
But one of that philosophy of yours, and that you then permeate through the organization, has led to some recent success in reference to the Robert Wood Johnson Foundation. Maybe you could spend a minute.
Yeah.
Let's talk about the big award.
Yeah, and talk about a transformational opportunity. Really, and when I say that, I don't even mean for Ascenda, I mean for New Jersey.
I agree.
Once in a while, we're invited to be a part of something that is so much bigger than ourselves and our organizations. And for us, the Robert Wood Johnson Award, for us to create and incubate New Jersey's first public health institute and the nation's first public health institute that is created specifically to address health equity, is incredibly humbling.
Well, you start though with what you shared with us already, right? Yeah. We exist in 21 counties. We have these hubs, so you've got a footprint everywhere, and it's different than an academic exercise.
That's right.
You're still going to be evidence-based, but you're looking at it from the lens of what you've just gotten done talking to us about, which is the family in crisis. Often those people who find themselves, as your parents were, poor, trying to make everything work, doing the best they can,
That's right.
and then medical challenges, disability challenges, all of these things, and then here you are, and now you have a platform to have that conversation.
Not to mention just how much work have we and our teams been doing on prevention, not having it get to a point where they're going to need those more intensive services. Quite honestly, one of the things I know we both talked about and our teams are talking a lot about is we don't want, if possible, someone's entry into the system to be through an emergency room or through a crisis program. We want to be able to give them education and engagement early on and hopefully keep them from getting into that crisis state. And and even if they're starting to see sign or symptom of there being an issue, to get them access to that outpatient, or those other levels of support. So we're not just a crisis-driven system. The Public Health Institute is going to allow us in a full comprehensive way to be able to move the needle for our communities and our state generally. And the heavy focus is going to be on health equity. It's always been an issue, and I think COVID just shined even a brighter light on it. But one of the most exciting things about this is because, and I think Inspira is a little unusual under your leadership in that you understand health not simply as access to medical care for someone who is sick or who is injured. Your health, my health, all of our health is defined based on our quality of life and the quality of life experience we have. That's what public health is about.
So now this is where you and I geek out, right? I'm a social worker, you're a psychologist, so now we're going to go into those models of care, and we promise we won't lose the audience, but I think here's the fundamental issue. With the right tools, people who are, before they get to crisis,
That's right.
can see the signs of crisis,
Yeah.
can access those services without fear of stigma.
That's right.
Right? It's not a sign of strength to gut it out, which I
That's
think
right.
is how many of us saw mental health. There
right.
are practical tools, there are services and experts who you
Yeah.
need to go to.
That's right.
And it's just like any other health condition. And maybe the fact that so many people experienced it through
Right.
COVID, that will change some of it. But we both know every single day we see our own teams
Yeah.
themselves
Yeah.
still hurting
Yeah.
and still coming to work and still feeling like care for others.
Yeah.
How do we, as you think about the work that's going to come out of this institute, it's not direct care, but it's really about driving the conversation, or how do you envision it?
Well, I mean, I think first and foremost it's what we talk about whenever we see each other. It's about acknowledging as individuals and professionals who've moved into mission-based work that if we're really about our mission, it has to be bigger. We know we need it to be more seamless when you're moving through some of these different, resources that are in our communities. And I think the most important first step is for us to, as I said a minute ago, is to say health is physical, but it's also social and it's also emotional. It's not just access to treatment, but it's also those social determinants of health. Do you have access to a safe, stable home? You can have the best pulmonologist. They go in and they see a pulmonologist in Inspira and they have the right diagnosis, they have the right clinical path to get them to, a healthy place, but then they go home and they have mold spores in their house because they don't have a roof that's
Right.
repaired.
So the lung doctor, can't control the housing environment,
That's
but they
right.
keep medicating them, seeing them, but it just gets worse because we can't change the environment.
That's right, and we see that with childhood obesity and with kids that were given a medicine because maybe they have high blood pressure and high cholesterol and other myriads of challenges. And can we give them medicine for that? Yes, we can, but can we also talk about structuring an after-school environment, giving them access to like a healthy adult figure, giving them healthy food? And to quite honestly break that multi-generational cycle of poverty and of poor health outcomes and, quality of life that is not okay. I mean, they need and deserve to be able to express themselves in this world and to grow and develop and blossom in this world. And we shouldn't be taking away that opportunity from anybody. And so I do think this is a time for us to be courageous. And I do think you raise a really good point, and it's one we made. And I'm so appreciative of the Robert Wood Johnson Foundation for hearing it. Urban areas need a tremendous amount of support and resource, and public health has a very real role to play there, but our suburban communities are hurting. Oh, yeah. And our rural communities, the barriers in access to care are profound. Yeah. At least in urban areas, you have greater density and access to a number of different types of settings. If you're in Cumberland County, rural Cumberland County, Salem County, Cape May even, you have real barriers to resources, and we have to do something about that.
And it is going to require work and time,
Yeah.
but the first step has got to be in the conversation.
100%.
And so if there's any organization that I know can begin to bring stakeholders together and convene those conversations and really
Yeah.
set the path out, I think the Robert Wood Johnson Foundation did a great job in acknowledging the work that you do. There are lots of people, I've told you this already, who are already calling, what is this Ascenda thing? Do you know him? Can you connect me? And it's an honor for us in our area to have your leadership and to partner with you. And so I just want to thank you so much for the time today.
Well, thank you.
I'm sure we're going to put up the number that you said because I know people are going to want more information about Ascenda. And we just wish you such great success, and of course know that Inspira stands by you to continue our partnership and our discussions on how we make our communities stronger and better.
Thank you. Thank you for your support. Thank you for this opportunity to talk a little bit about this incredible organization and what we're doing, but also thank you for allowing us to be models of what it is that we're talking about today, which is true partnership, where we're really in it together and we're committed to do partnership to be more and bigger and more robust and more impactful than we could otherwise be independently. So thank you for
so
that.
Much.
Thank you.
And thank you for watching today. We're so grateful that you tuned in. Again, until we meet again, be well and stay safe.